Welcome back to Active Living is Active Life. Joining me now is Susie Hammock. She was District 4 Health Services, and we're out here on the porch, and we're socially distanced and safe, so we're going to put our mask aside right now to talk about the important issues of COVID-19. Susie, thanks for joining us today.
Thanks for having me.
Tell me a little bit about your role at District 4 Health Services.
So at District 4, I'm the Accreditation and Quality Improvement Coordinator. I'm in charge of our national accreditation as well as any quality improvement efforts throughout the district.
Okay, and you were kind enough several weeks ago to come and speak to our older adults here about COVID. But before we talk about older adults and COVID, tell me a little bit about an overview of Troup County. How are we doing as far as infection rates of COVID now in Troup County?
So Troup County is doing much, much better. I looked at the numbers this morning before I came. Our worst day was June 23rd. We had about 116 positive cases in one day at our peak. Yesterday, I think we had 7 new cases, so it's significantly better. The trend is definitely going down. It's probably due in large part to mask wearing. If you'll notice, when you go to pretty much any store now, mask is required, and I do think that's having a large impact on those numbers.
Excellent,
Yeah.
excellent. So, and that follows the trends of Georgia too. Georgia is doing much better as a state.
Yes, compared to Georgia, we're pretty much right on track with the state as a whole. Everybody is doing, there's a couple of counties that are getting a little worse, but those are mainly the smaller counties where just a couple of people can make their numbers look way worse. But as far as the state as a whole, we're about on track with the rest of the state.
Excellent, excellent.
Yeah.
Well, I want to talk about older adults and COVID. We have lost a number of our members that were previous members that were in the nursing homes here. And recently we lost one of our active members to COVID, and that's very difficult.
Yeah.
So I want to talk a little bit about safety for older adults. We want to keep them safe through this. And the first, where do we stand as far as shelter at home? Are there some older adults that should be still sheltering at home? And who are those older adults that should be doing that?
So I think anyone, over the age of 65 needs to prioritize where they go.
Okay.
So if it's going for a walk outside, please go get your exercise. Enjoy this gorgeous weather. You're completely fine to go outside and enjoy nature. Go into the grocery store, just put a mask on. It's okay. Right now, I would say that that's perfectly fine.
Good.
Now, if you're talking about going to church or going to somewhere where a lot of people are gathered indoors, with or without masks, if you're over that 60, 65 year range, and especially if you have cancer or have had it, or if you're immunocompromised in any way, we still would recommend enjoying that from the, if your church offers virtual, maybe enjoy it from home. Anywhere that's going to cause you to be, with other people in an enclosed space is still pretty risky for older adults, especially immunocompromised.
Right. I know some of the most challenging situations older adults face is when they lose a loved one and there's funerals.
Yes.
And of course, family members that get married.
Yes.
We've had a number of older adults struggle whether they should go or they should not.
Yeah.
And I know that some of the funerals that are held outside and people socially distanced, that's very much more safer situation.
Yes.
And so how do they evaluate as far as a situation that might be indoors, that maybe they go to a church and there's wide open spaces and they can socially distance, stay away, and everybody's separated, and how are there some guidelines that they should really evaluate before they even get to a place to say this is going to be dangerous versus this could be safe?
Right. Funerals and weddings are extremely difficult calls to make, because especially if it's someone that you're really close to, do you not go to their funeral? Do you not go to your daughter's wedding or your granddaughter's wedding? I mean, those are difficult calls to make. You have to remember what the most important things to think about are, how's the air circulation?
Okay.
Like you and I are sitting outside right now, we can have a conversation. We're not in danger right now. We're more than 6 feet apart. We're in open air. We're okay. If the funeral is going to be indoors, ask ahead of time, are masks going to be required? If it's someone close to you, that you may be able to convince them to require guests to wear a mask, that would be worth the effort.
Okay.
At a wedding, is it outside? Will masks be required? Space is what's most important. Masks are extremely important, but just as important as masks are space.
Okay.
So even if you and I both had on a mask and we were sitting inside and we were 2 feet apart and you were sick and didn't know it, I could still catch COVID from you in that situation, even with these on. So the space and the masks, the combination of the two are what's important. So even though I can't imagine how difficult it would be to be 70 years old and someone very close to me passed away and their funeral is going to be indoors and they're not requiring masks, that would be extremely difficult. My unbiased third-party opinion would be that's too risky for you to go to, but I understand the predicament that some people are in, and I think the best thing you can do is try to talk to the people that are setting up the funeral to see if they can accommodate the masks and the spacing. It's just a difficult situation.
Well, let me, even more uncomfortable and touchy subject is a family's responsibility to their older adult.
Yes.
And that is very difficult, and I see that a lot of families with grandchildren and all are not being protective of their grandparent.
Yes.
And that's, easily a grandparent could catch it from the grandchild.
Absolutely.
And that could be devastating for a family to have to live with that.
Oh my gosh.
Their grandchild, or they allowed a family member to give that. So I know it's difficult because people like to hug and to be close to their loved ones. But any advice that you give on that, or speaking to those that are watching that are younger that maybe have not thought of their responsibility to their older adult relatives?
So there are ways to still have real human connection with these people in your life that are safer. So even though I know there's nothing more wonderful than a grandchild crawling in your lap and giving you kisses and hugs, and how wonderful that is for the child and for the grandparent, and you may feel that you're taking that away from them, it's not worth the risk, especially if that grandparent is older. There's some younger grandparents who are healthy that probably are going to be okay. But some of the older grandparents, let the child give you a hug on your side.
Okay.
Pat them on the head. They can give you a really good hug on the side. They don't have to get in your face. Writing letters back and forth with grandparents, talking on the phone, having conversations outside. We've been doing since the beginning of the pandemic. My husband's grandfather's 87. He's at the high risk category, but he was lonely. So we had him come over outside. We put all the chairs 6 feet apart. We cooked dinner. We brought it to him on a paper plate with a plastic fork and a plastic cup. And he got to visit with everyone and feel included, but we were not putting him at risk. And there are ways to do that. You just have to be creative and know that this is not forever. This is not your life until the end of time. This is a bad situation we're in right now, and if we can make it out alive, that would be great.
Oh, that's wonderful.
Yeah.
Now, when you spoke to our older adults here, you mentioned about the formula you use for close contact. And you had mentioned just before, a lot of people don't realize that if you are closer than 6 feet is it over 15 minutes? And even if you're wearing a mask, that's still close contact.
Yes.
That you would potentially be vulnerable to catching COVID if the person has COVID.
If it's within 6 feet of each other for 15 minutes or more, with or without a mask, over 24 hours. So that sounds kind of complicated, but if I spend 5 minutes with you 4 times in 24 hours and you've got COVID and I was closer than 6 feet, I'm now a close contact to you, even if it was only little 5-minute, pieces. It doesn't have to be 15 minutes all at once. And that is a change from the very beginning. So.
All right. Well, I'm glad you said this will not be our lives from now on. And I think a lot of us are looking toward the vaccine to help us. Give us an overview of what is District 4 Health Services' role in the vaccine when it rolls out, and tell us a little bit about anything that you know as far as what the procedures will be when a safe vaccine is released.
So a big function of public health is exactly this situation. It's the kind of thing you plan for, but you hope you don't have to use it, but we practice every year. There are things called pods, which are points of dispensing, and if there was an anthrax attack, that's always the situation we use. You got to give the antidote, So we have places in each county in our district where cars can drive through and get a vaccine or get whatever it is when we have to give out mass amounts of something. So for this vaccine, we would use these pods, and we would let the community know where that is. And exactly how we've been doing the testing with the drive-through, it would be like that. So say a pod was, the health department, right? You would drive through, you get your vaccine, and you drive off. And it's very quick, and we like I said, we practice this at least once a year. We are planning at this moment of how we're going to be distributing the vaccine, how that may interact with also the flu vaccine, with other things that are going on. How do we, manage that? So those plans are currently being crafted based on what we've been planning for forever if something like this ever were to happen.
Okay.
Yeah, so there's 3 different tiers that the vaccine will be distributed in. So tier 1 will be healthcare workers and their families.
Okay.
Tier 2 is the older adults, and then tier 3 is the rest of the general population.
Okay.
And so when the vaccine is released, it will be the healthcare workers and their families that will go first, then the older. So that's why they're saying widespread distribution. They're guessing by the middle of next year. They're more than likely it will start being distributed before that. It's just by the time we get to tier 3, it may be the middle of next year.
All right.
Yeah.
Now, do you know, is it a similar needle is the flu vaccine, or that would be injected in the muscle, or do you know how that works?
I'm not sure if it's a intramuscular or just subdermal. I'm not sure what type it is yet, but I'll let you know when I find out.
All right. And you mentioned flu, and during this crisis, other health issues have continued. People haven't stopped with heart disease and all that, but one concern that I'm sure District 4 has had is people neglecting to take care of themselves in other ways.
Yeah.
And flu season is coming upon us. How important is it for older adults to still get a flu shot, considering what's going on now with COVID? Some of them may be scared. I don't want to get out and get a flu shot. Right. What should they do?
So you said 2 important things. One is don't neglect your regular health care. If you have an appointment with your doctor, you need to go to that appointment. Your doctor has had months now to, decide how to keep the office safe and the protocols. It's safe to go to the doctor, wear a mask, do what they ask you to do, get your temperature taken, but don't neglect your other health issues that you have. That's the first thing. Secondly, the flu shot is more important than ever this year. Please, if there is one thing you do this year, please go get a flu shot. We usually look at Australia's flu season because, they're coming into springtime right now and we're going into fall, so they just had their winter. And so we look at their flu season every year to kind of predict how bad it's going to be here. Their flu season this past winter was almost imperceptible for 2 reasons. One, almost everybody wore a mask, and their flu shot numbers were through the roof. Unprecedented numbers of people got their flu shot in Australia because they understood how important it was to not get the flu and COVID at the same time. It will be catastrophic if we do not have people getting their flu shot, because if you get flu and COVID at the same time, it's not going to be good. If you make it, it's not going to be good news.
Plus, you think of packing out hospitals and all of that if people don't get their flu shots.
Our healthcare workers have had a horrible year. Please don't put them through any more, craziness. We have the opportunity right now to do the right thing, and for this fall and winter to not be as crazy as they're predicting. The predictions right now are based on how things are going now. And what they're looking at right now is starting in October, things are going to get significantly worse as a nation, right? If we buck the trends and we say, okay, normally about 40% of people in Troup County get the flu shot. If we say, you know what, I never get the flu shot, but I really, really don't want the flu and COVID at the same time, I'm going to get my flu shot this year, which, by the way, is free for the majority of people if you have insurance. And even if you don't, it's $25.
Right.
Compare that to hospital bills
worthy
and dying,
investment.
and
Okay.
it's worth $25 to go get it.
Bottom line, get that flu shot.
Please get your flu shot.
Well, Susie, thank you so much for joining us
Thanks for
today and
having
this
me.
important information. And we hope to put those practices into place and keep our population, especially older adults, safe.
Yes, absolutely.
Thank you. We'll be right back.